Unit 16. Open wide. Dentists recommend that everyone have a dental checkup at least once a year. A dental examination includes x-rays of the teeth to detect decay or other problems, such as an impacted tooth. An impacted tooth is one that is unable to break through the gum. The condition of the gums and other soft tissue is also noted during routine checkups. Previous dental work, such as fillings, are examined for flaws that need correcting. When a tooth is found to have a cavity, the decay is removed with a high-speed drill before the cavity can be filled. Usually, the area where the work is to be done is numbed first with a local anesthetic. The material used to fill the cavity may be a mixture of silver and mercury, or it may be gold, porcelain, or plastic. This is packed tightly into the cavity and the outer surface is smoothed. When decay reaches the pulp of a tooth and inflames the nerve, causing pain and infection, root canal treatment is necessary. The pulp is removed from the tooth and replaced with metal, cement, or some other material. A crown, gold inlay, or filling material is used to close the cavity. Crowns or caps cover the entire tooth. These are used when the enamel of the tooth has been removed. Crowns are made of porcelain, plastic, or gold. Pulling a tooth or tooth extraction is considered a last resort. Dentistry today strives to preserve the teeth and avoid dentures if possible. Some exceptions to this rule improve the health of the mouth. An impacted wisdom tooth or third molar, for example, can crowd the teeth and cause discomfort. Teeth may also be removed when the jawbone is too small to have room for all the teeth. Dentures, either partial or complete, must be carefully fitted to the patient. Partial dentures or bridge work can be used when some of the natural teeth remain in the mouth. Such dentures may be removable. They are held in place by clasps that attach to nearby teeth. A fixed bridge is permanently attached to natural teeth. Complete dentures are removable and are held in place, if properly fitted, without adhesive paste and powders. Misaligned teeth can be slowly straightened with a structure of metal bands and wires, commonly known as braces. The best results are obtained when this treatment, called orthodontia, begins in childhood or adolescence. Unit 17. To the rescue. With training, a swimmer can learn the proper way to rescue a drowning person. If the drowning swimmer is close to shore, a rescuer may throw a board, rope, or ring buoy and tow the victim to safety. If a boat is available, the rescuer may row out to the victim. A rescuer who is a strong swimmer with life-saving practice may choose to enter the water to save the victim. Many people who drown do so because they panic and thrash about in the water. In their panic, drowning victims frequently attempt to grab would-be rescuers to stay afloat. Rescuers who are not strong swimmers risk being pulled to the bottom with the victim. One method of rescuing by swimming is to get behind the victim and pull her or him by the chin to a level position. With one arm, the rescuer then reaches over the shoulder of the victim and grasps her or him across the chest. The rescuer's free arm is used to swim a modified side stroke. A shallow arm pull and inverted scissors kick are used to bring the victim to safety. Like heart arrest and choking, drowning requires immediate action and basic life support. Near drowning is much more common than fatal drowning. The near drowning victim may have no symptoms or may need help because of difficulty in breathing and confusion. The drowned victim will be unconscious and will not be breathing. Water in the lungs results in a decreased ability of the air sacs to supply oxygen to the blood. The immediate problem of the victim is a lack of air rather than an excess of water. A rescuer should not try to pump or drain water from the lungs. Mouth-to-mouth resuscitation should be employed if the victim has trouble breathing or is unconscious, even while the victim is still in the water. If the victim's neck or back might have been injured, the rescuer should support the victim in the water in a level position until the victim can be eased onto a flat board. Rescuers should not give up on a victim until she or he is pronounced dead by a physician. Getting the victim to a hospital quickly is vital. Humans have a reflex that slows the body's processes in cold water. This reflex can sustain life even though a person has been submerged for more than a half hour.